Oh, hey guys. Oh, so good. This is a pumpkin cream cold brew. Gotta have a Starbucks. Happy fall, y'all. I'm coming to you direct in nerd mode, glasses on, bright colored lipstick, fog it up, favorite leather jacket. We're doing this. So in today's video, I wanna just say first, welcome to the Leadership Collaborative. I'm Kayla. I'm like super excited. You guys, I'm excited. Today's topic, we're gonna be talking about what is public health? So in today's day and age, and what I mean by that is COVID, we're hearing a lot about public health in the media, and I think that it would just be a great topic if I talked a little bit about what it is, because I think a lot of people still kind of wonder when I shared that I was going to school for my master's in public health, a lot of people sort of looked confused and said, like, what is that, and what are you going to learn? So I thought I would just give a rundown of what is public health, what I've learned, and what I'm doing differently now that I have some public health background, and what I really want to focus on in the future. If you guys like this video, I'm going to keep doing just like public health topics on this channel because I think it relates to leadership in a really great way, and I have used a lot of the skills from my master's as a leader, and so I continue to share those with you guys. All right, so let's dive on in. What is public health? So it is the science of protecting and improving the health of communities and populations and people within those communities, obviously. Communities can be small, like neighborhoods or zip codes, but it can also be big, like countries or regions of the world. And we do this by prevention through education, programming, program implementation, policies, laws, services, research, qualitative and quantitative research. I think public health sounds like a soft science, but it's actually a very hard science. And what I mean by that is there is scientific research involved, epidemiology, which is like studying prevalence data, mortality, looking at statistics. Yes, I took biostats. Yes, I survived. I think I got an A-. It's okay. I'll take it. It's very complex, and also it has a lot of parts to it where you're really talking to people and you're exploring and you're listening, and so there are social skills required for doing public health work. So I think it's why I like it, because it's a great blend of the hard science and specific data and all of that, and then there's this human aspect, right? Populations, communities, like people's livelihoods. So the difference between public health and I would say like medicine is often aimed towards treating disease. So after you're already at the doctor. Big caveat here, I currently work for a healthcare organization, and after the Affordable Care Act was passed, there was such a thing created as accountable care organizations, which just basically means that healthcare organizations or providers' offices were starting to be required to really care about communities and care about population health. Super cool. So there was this framework called the triple aim of care, healthcare, and it included things like caring about the population and community health, which basically says that healthcare organizations are responsible for their community, and with that comes preventing disease. Also, quality of care, providing quality of care for a low cost, rather than charging tons of fee-for-service procedures, really thinking about like how do we provide the best care in the most streamlined way that's really affordable for patients. So I will say there is a big shift to public health, this public health responsibility, even in the healthcare space, which has in the past primarily only been concerned about treating disease after it's happened. So I'm really happy to see that. Even the organization I work for now has a population health department and group, and we talk about cost of care, and they talk about preventing disease and community outreach. There's even a community brokers group, which is basically just amazing people who live in the communities we serve and can work within those communities to help us as a healthcare organization understand how to meet the needs of those people and to meet the people where they are. So I think that is a cool thing. Public health is also really concerned with the social determinants of health. So there's some big buckets, but there's a lot of different social determinants of health. And I bet you can even think of more as I start to name some of these off. So things like socioeconomic status, education, the neighborhood where you live, your built environment, the environment that you live in and see and walk in every day, your employment status, your social networks. So essentially, all these social determinants of health determine how, your ability to be healthy and to live to your fullest potential. And we talk a lot about health equity. So health equity is when everyone has an opportunity to obtain their fullest health potential, and they're not, disadvantaged by any of their social positions or other social determinants of health. So we strive for communities and people to obtain their fullest health potential, and that's health equity. And if for some reason they have a social determinant of health that is a barrier or to their health equity, that's where public health gets concerned about closing that gap. For example, thinking about communities, I saw this ad in Baltimore for an election that's coming up right now, and it showed just the brokenness of the structural, how the community looked. It was run down and there was no investment in the community. And you think about the people that live there and see that every single day. They probably don't feel safe. They might not be able to walk in their community if there are no sidewalks. There are broken windows. Can the children play in the streets? Can they play in a park? Is there a food desert there? Are there grocery stores with fresh produce, or is it all non-perishable items? Everything that you see every single day affects your ability to find health. And, is there a community health center in that neighborhood? Or you think about poverty. If you're in severe poverty, you might make different choices than if you have an abundance of finances. And some of those choices may mean that you sacrifice your health to just survive, right? Because you're just trying to get by. So when we think about public health, we're trying to identify how do we close the gap by making things more equitable for groups that need that support to obtain their fullest health potential. So again, we do this through policy, interventions, education, or programming, and even just research to learn more about the community. I think, why do I love this piece and how is it applicable to leadership? Well, first of all, I think public health has helped me to not make assumptions about certain groups or about just individuals as I'm going about my day. So I think it's really easy to see someone acting in a certain way and then make an assumption just in the split second about why you think they're acting that way. And oftentimes we don't really know about a person's situation. We don't know what kind of environment they're living in or what choices they have to make based on their social determinants of health. It can be really easy to assume that their lived experience is your lived experience or my lived experience. And public health has really helped me pause to consider the other, to consider people probably have a different lived experience than me. I think part of what helps me do this is I did grow up in a very rural area and I did go to school in a very urban area. And so I have those two perspectives, but I realize there are a lot of groups that are living in a different experience than me. And so it's also helped me want to learn more about those communities and help them learn more about me and just try to understand where everyone's coming from. I think it can be scary to start to ask questions or to try to be present to different experiences if you're just feeling like you're not prepared to answer questions or to fully understand. But I think what we can do is just lend an ear and start to listen and let those voices that might be disadvantaged or not heard as much, let them be heard and listen and really digest that information and then go do your research. So the third thing is that public health has really allowed me to get excited to educate myself and do more research on topics that I'm interested in. So I want to talk a little bit about what I'm doing right now with the racism movement. So I don't know if I can say it's a movement, but there's been racism, or what we're calling structural or systemic racism in our country for a very long time. And so, there are a lot of things that we can do about that. I think the first thing is just educating yourself and becoming more familiar with the topics, and then thinking about what you can do. So the first step for me is to just acknowledge that yes, racism exists and I need to learn more and use my voice to do something that is anti-racist. So I'm reading this book called How to Be an Anti-Racist. In the book, they talk about you're either having racist thoughts or doing having racist actions, or you're having anti-racist thoughts or anti-racist actions. And you can be the one person and have both racist and anti-racist thoughts or actions. It's not like you aren't a racist or you aren't an anti-racist. It's your actions and your thoughts and your behaviors, right? So basically, it's getting to the point that we all have work to do to dispel structural racism or structural poverty or, whatever it is, by actively using our voices and our behaviors to do something about it. Basically, the line is, if you aren't doing anything about it and you're being complacent or, just silent about it, that's pretty much that's racist, right? So but if you're taking action, that's anti-racist. I hope you guys will learn more and read more about this book. Of course, I'm stumbling over my words because I'm still learning, and I'm only through chapter 2 of the book, but I'm really excited to share this. And it's not easy to talk about, but I think because it's not easy, it's why we need to talk about it. And I want to recognize my whiteness and my white privilege. And, if we think about it in terms of leadership, if you are a leader and you're leading teams, is your team diverse? Do you have more than people that look or act like you? And if so, do you know about them in the same way that you feel like you know about yourself and your race or your gender, or whatever it is? What can you do, or how can you learn to interact with those groups better? There's such a thing called cultural competence, but I think we need to be careful because we want to make sure that we're not going in and saying, yep, I read the book. I know everything there is to know about being anti-racist, and I know everything to know about Black people. No, that's not true. But I think being sensitive to the things that you're saying, the actions that you're taking, and continuously learning, that's where we need to be. So public health has made me more comfortable just starting to peel away the layers to say, I need to learn more about this. It's no longer acceptable for me to go through life and just not consider these things, especially when I have friends that are Black, when I have different types of people in my life that don't look or act like me, and I consider them my friends, and I need to stand for that. When Philando Castile died, I was devastated and I didn't do anything. I was just angry. And then everything with George Floyd happened, and I was like, oh my gosh, I haven't taken action. And then things happened in Kenosha with Jacob, and I'm from Kenosha, Wisconsin. So now is my time. So I want to look at this through the public health lens, and things like racism or poverty or socioeconomic status or networks, those are all public health issues, because if people can't achieve their fullest potential, that's not health equity. Talk about structural racism or structural whatever or systemic whatever. Something I learned in that book, How to Be Anti-Racist, and something that I knew but didn't realize I could speak to this, is we're really talking about policy, racist policies that favor people of higher economic status versus people in poverty. Policies are the law, and they're the way that we live our lives because of just how things have always been, because of whatever has been written in the law. So I would just urge you to consider, if you have a topic that you're passionate about, that you read about, that you see in the media, start thinking about what policies you know of exist in our world that maybe favor one group and disadvantage another. When we create policy that's equitable, I think we need to look at what can we do to lift these groups up that are disadvantaged so that they can receive and meet and get their whole, their fullest health potential, rather than just being excluded from the equation. I think as a white person, it's so easy to just sort of not even realize that others aren't being considered. Even if we have the best intentions and we think that we're doing good, we need to consider others. And I think that's why, I hear of more groups bringing on diversity and equity teams, because then they can bring in more folks who can be more representative of the populations they serve and speak to some of those things, rather than like us white people just trying to make up what we think would best help those communities. That's not the right way to go about it. Some classes I took when I was in public health school that have really opened my mind about this whole topic include like public health law, law, medicine, and ethics. I took community engagement strategies, global health, the science of like healthcare in the United States, and we talked about healthcare in other countries. I learned about program implementation and evaluating whether a program worked. So for example, if you're going to create a program around smoking cessation, how do you measure if the actions you took during that program are working, other than like a very obvious of this many people aren't smoking anymore, things like that. And some really cool skills that I've gained are doing analyses of, what's it's a SWOT analysis. So basically looking at like what are our opportunities, what are our barriers, successes, wins, all of that. Looking at policies and comparing different laws and structural policies and saying like which one would be the most beneficial. Doing legal case briefs. So looking at the law, looking at the Supreme Court, and thinking about precedents and why we do what we do today because of past Supreme Court rulings. I've created program plans and implementation plans and evaluation plans and monitors. I took biostats, like I said, epidemiology, statistics, look at incidence, mortality, risk, all of these things. And then, of course, I had taken classes on research, so qualitative research like listening, interviewing, observations, and quantitative research like randomized control trials and things like that. So my mind has just been opened up so much to just feel more comfortable talking about these things and just considering as a leader, how can I, if I'm going to implement something, can I use a program plan template from what I learned in public health school? If I'm going to approach a sensitive topic, can I think about like someone else's lived experience and maybe release the fact that I don't know all about it, but I know about mine, and I can start to try to understand where someone else is coming from, and not make assumptions about others based on my own lived experience. And can I just ask more questions to try to better understand? So if you're considering public health for your master's degree or to study, I would highly recommend it. Put in the comments if you're interested, and I can direct you towards some resources. I will also link to the CDC's website and probably the Public Health Association's website as well, because I did use them for some references about like what is public health. And I'm getting my master's degree through George Washington University through their online program, which has been amazing to do. And I love going to DC. And so I had gone out there a couple times, did some leadership seminars out there while I was doing the program remotely. And it just fuels me like no other to be in a room with folks who are just eager to learn. And I feel like, even with COVID, before that we were online doing like Zoom meetings for school anyways. So I've met people from all over the world who are in these programs, and it's just opened my mind. Like, I feel like I'm ranting a little bit, but I'm just so passionate about this. So I hope that you guys allow me to continue to come on this channel and just share more about what I learned. It's such a huge topic, especially thinking about like all these structural or institutional things that we need to break down so we can build each other up. And in the meantime, check out that book, How to Be Antiracist, and start thinking about like the social determinants of health that affect your fullest potential And I'll post some infographics as well in the description so you can look at the different social determinants of health and see more about what I'm talking about. Okay guys, thank you so much. If you enjoyed this video, please give it a thumbs up, subscribe, and hit the bell so you never miss a moment from me. And feel free to check out the other playlists I have going so you can learn more about leadership, productivity, being mindful, my morning routine, etc. All right, talk soon. Thanks.